All right. Hello, everyone, and welcome to Virtual Care using virtual visits, RPM, and assessments to engage patients and improve adherence. I'm Ryan, part of the AHHC team, and our speaker today is Michael Pepe, Director of Solutions Engineering for Cinzy. I want to remind you that you may post comments in the chat feature or questions in the Q&A feature on your right, and please post them there. At this time, I will turn it over to Michael.
Thank you, Ryan, and excited to be here and appreciate everyone's time this morning before lunch. So again, my name is Michael Pepe. I run our solutions engineering team at Cinzy and really help our clients that are new and onboarding uncover business cases where they need to implement a virtual care solution in their organization that really ties patients, family members, and staff members and allows them to communicate in a secure environment. So a little bit just real quick about Cinzy. We're a virtual care company based in St. Petersburg, Florida. And we're really a comprehensive communications platform, not just for telehealth, but some of the other aspects of virtual care, which we'll cover today and which we saw during the pandemic. Full administrative type of features within the platform. And that's very important when you're looking at a virtual care platform, is to make sure there's the proper dashboarding, reporting, where you'll be able to have full transparency into the platform. So like I mentioned, today we're really going to cover the role of virtual care, and we're going to have a focus on what we've seen in the marketplace during the pandemic and some of the adoption that was especially happening during the pandemic. But now that we're moving further along, what's really next up? What are some of the trends that we're seeing in the marketplace? Is it staying? Is it getting less? Is the technology really being adopted, and how are some of our clients using it? So Cinzy, a company itself, we're solely focused on healthcare. Majority of our clients, about 90% or probably greater, are in the post-acute, home health space, hospice, palliative care. So we really developed our platform, and I'll be speaking from a virtual care standpoint from a home health, hospice, type of organization and what we saw over the past year and a half as well. So looking for a platform that's, innovative, provides on-demand care. Every industry, as you can see, and this was very big, especially before the pandemic and during the pandemic, every industry is essentially adopted an on-demand type of model, and everything that you use today in your daily life is on demand. But of course, healthcare technology has come last in that. So whether it's how you watch a movie, especially during the pandemic, or a TV show, you weren't going to Blockbuster anymore for some of those folks that remember that from 10, 15 years ago. How you're ordering groceries, Amazon versus going in person, or just what everyone knows, Uber and Lyft versus traditional taxi. But healthcare is really starting to catch up. We're really starting to put that to the forefront. You're going to see your patients, their family members, are looking for a type of service, and whether that's in a virtual environment, of a more on-demand type of service. People, unfortunately, good or bad, really like to have things immediately today and on demand. Why not healthcare? And we're seeing the agencies that are adopting that are really succeeding for that. So just a little bit about some of the use cases that I work with our client base before they onboard, and what they're really looking to solve for within their organization. So there's a variety of ways to use our platform and a lot of other virtual care platforms. It's not just bringing a patient in or another staff member in on a video visit. There's a lot of comprehensive platforms out there, especially ours, where you can use a variety of modalities of communication. So not just telehealth, but you can use whether it's patient program messages that are being delivered via SMS or email, or maybe an assessment. And we're going to cover all these. But a lot of our clients use our platform to manage patients with a chronic condition, multiple chronic conditions. So how are you sending education, electronic education? How are you doing a virtual visit? How are you gathering more data, maybe even monitoring patients in real time using a blood pressure cuff or a pulse ox type of device. What are you doing with all that information, and then how are you communicating with them virtually if you're not there in person? So, some of the many ways that that our clients are using the platform is really what you're seeing on the slide. But really the last one there in the bottom right, we have the ability within our system as well to do emergency preparedness, and this was big during COVID, but also if you think about across the country, and we span across the country, so our client base is everywhere from rural Texas, Oklahoma, to California, to Southeast, doesn't matter where. But for all you folks in North Carolina, I'm based down here in Florida as well too. We have a lot of our clients that use a mass blast type of message where it's hurricane season. You might want to send out a quick text or email blast out to your entire patient population as well as their family members. So we give you that ability as well, that if you do need to plan for a hurricane, make sure you're filling up on your medications. Here's the phone number to call if you have any questions. It's a nice, easy way. Instead of phoning up each patient individually, leaving a voicemail, you're able to deliver this type of content electronically. You can attach links as well too. So if you want to include a website link or anything within those messages, you're able to. So some of the benefits of virtual care, and this is really what we've been gathering over the past couple of years, but we've really seen this come to the forefront over the past year, is major benefits for employees and staff at your organization is just reducing the drive time and putting eyes on the patient on demand. So those first two bullet points right there. And we're going to cover a specific use case that one of our clients did and how we highlighted it. But, really the benefit of it's Sunday night at 10 o'clock and, your patient, I might be a nurse, my patient's an hour away, and, it might not be an extreme emergency situation, but I'm not able to really get good information just over the phone. So just the quick ability that, I could see them virtually over video real quick, make them feel calmer, answer any questions they have. And that's really one of the biggest things that we've seen with patients as well too, is that sometimes they just need that reassurance that you might not be able to give them over the phone, that you're able to do that over video. Really, another major benefit of the platform, and we have a lot of case studies and white papers done on this with our client base as well, is minimizing ER visits and readmission. So we're going to talk a little bit about how, our patient program management, sending out education, and just the virtual visits itself really reduce that, but gives that patient that ability, instead of picking up the phone and maybe calling 911, maybe they're a high risk, high acuity type of patient. You can give them the ability within our platform where they can reach out to a care team member. Maybe it's just not as urgent. Maybe they just need to send a secure communication, a text or a chat, send a picture of what's going on. Maybe they have a rash. Maybe it's a wound care type of situation. But being able to just on demand really communicate quickly with their care team has really minimized a lot of ER visits for our clients' patient population. We're going to talk a little bit more about optimizing supplies and just increasing clinical standardization when I bring up that specific client use case. But really big one is on the wound care side. We have a lot of our clients use the platform for wound care. So whether that's triaging an issue or maybe just not wasting a specific amount of bandages. So we found, one of our clients was, the specific patient was changing their bandages too often. They were a wound care patient. So being able to do that education virtually, where you might not be able to get to them in person in time, has been a big cost saver for many of our clients. And of course, improving quality of care, right? So that really where it ties in with the patient, with the family member, where I need to make a timely decision. I need to provide timely care. I'm able to, we've found, and just through a lot of research and a lot of other telehealth vendors as well too, the quality of care is greatly increased versus over the phone trying to help a patient through that. So really what we do, we're trying to address different gaps in care, and whether that's, a patient not being able to reach their specific nurse or an agency, maybe on after hours or on the weekends. We've seen a big uptick in behavioral health as well too. Wound care is one that I mentioned. We're going to go through PT and OT. So we have a lot of clients that use our platform for physical therapy and occupational therapy as well too. So how are they really using that platform? And there's a variety of ways, not just let me show you this exercise over video, but being able to include, here's a link to a video on a specific exercise. And these can all be set up to go out automated. So it really takes that burden off your staff as well too, that, if you have a specific plan of care for a patient, and on day 3, they're going to get a specific message with an exercise, you can all automate that with virtual care platforms. So really the bread and butter of any telehealth company, but especially ours where we started, is our video virtual visits. So not just the ability to have a one-on-one communication with clinician to patient, but we also offer clinician to clinician secure video communication. So we've seen this a lot, and I'm going to bring this up in one of our client examples. But if a specific nurse was maybe at a patient's home, needed to bring in a medical director or a specialist, they can all do that remotely. We have a lot of our clients that use the platform just for that, not even for patient to staff communication. And those staff members are able to securely, answer those specific questions. But, a lot of times what's really being spoken about when you're doing these virtual video visits with patients, the most common one could be just on day 2, maybe post discharge from the hospital. It could be, do you have any questions on your medication? So medication reconciliation and adherence, and just answering those questions on demand. Maybe it's not a scheduled telehealth type of visit. Maybe it's just an on-demand type of appointment, but being able to have that conversation where the patient can show, their specific prescription bottle or their pill bottle, and I don't remember what you said. I don't have the handout. How often do I take this? So just being able to answer those questions on demand has really improved the quality of care. And then the big one is, I need to bring in a family member. So if you see in the slide down here with the patient, and then you have the staff member, the clinician up here, this looks like a family member down there, right in the bottom, right? So maybe you're having that conversation with the patient, and the patient says, hey, could you go ahead and bring in my daughter who's in South Carolina or Florida, or maybe she's just not able to get to the visit today because she could be at work or have another appointment. So just being able to bring in all those folks remotely, we've seen a major uptick over in the past year and a half. So one of our newer features, and there's some vendors out there in the marketplace that just specifically do remote patient monitoring. They might offer specific devices like a blood pressure cuff, a pulse ox, a scale, and there's a lot of companies out there that do this very well. But they tend to get very very costly, because most of the time they're leasing out their proprietary devices or equipment, and most likely it's usually cost per patient is for a variety of ways to use this. But we've added remote patient monitoring about 9 or 10 months ago, and we took a pretty different approach than a lot of other vendors in the marketplace. So just like our virtual care platform is device agnostic, where if you have an Apple device, if you have an Android device or a computer, you can use Cinzy on any device. We took the same sort of approach with remote patient monitoring. So we took, I think, a pretty forward-thinking approach, where if you've ever been in CVS or Walgreens or Target, you might see a Bluetooth blood pressure cuff or a Bluetooth pulse ox. Those are the types of devices that we're able to connect with. And the reason why I bring this up for this specific presentation is this was a huge point during the pandemic, where a lot of patients might not want to use a used pulse ox or a blood pressure cuff or a thermometer that was used by another patient. So we saw a lot of family members or patients just go on Amazon, just go to Walmart, Target, pick up a $30 Bluetooth type of thermometer and then a pulse ox device for maybe $40. You could order off of Amazon, or you can get them in Target as well, where you can monitor the patient's oxygen levels and heart rate. We've seen a lot of those folks over the past year. They have that equipment already in their home, or a family member might have purchased that for them. So being able to connect these devices where you can monitor patients that are at risk. Maybe you want them to take their blood pressure once a day. You can send them out automated reminders that you can customize per patient. And this all gets fed real time back into our platform. And if you see this blood pressure that's highlighted in yellow, we have the ability, you can create alerts as well too. So if a patient does cross a threshold that you have set, let's just say they take a high blood pressure reading, anyone at your organization can receive an alert to their iPhone, to their mobile phone, to their tablet, wherever they're logged in on Cincy, and automatically get that type of alert. So really being able to not just communication, we were very solely focused on communication for many years, but now able to monitor these patients' vitals, and then from there, go ahead and communicate with them virtually, whether that's a virtual visit or some other method. So this is really just another screen grab of the provider view, and this is what it typically looks like on an iPad. So very similar to the screenshot that you just saw earlier, where you're in the patient's profile and viewing the patient's vitals in real time. From an administrator standpoint, we have a whole administrator enterprise admin type of portal where different administrators can have different levels to access through here, but this essentially gives you the keys to the kingdom, enterprise admin, whether it's managing users or clinical content. But from a remote patient monitoring standpoint, administrators will give you dashboards of who's missed a reading for today, who's taken a reading today on a device, how long it's taking your staff to reach out to that specific patient. So as administrators, you can really stay on top of what your staff, how are they engaging with patients that are monitoring their vital signs. Another major aspect of our platform and a lot of other virtual care platforms are assessments. So you might want to have a way to gather data from a patient. And, we've seen a lot of times, and especially during the pandemic, where if a clinician was not able to get to a patient home, I want to send out a quick assessment to all our patients, or maybe individual patients. Are you experiencing any of these symptoms? Yes or no? Then multiple choice questions. Maybe the ability to enter in a text box how you're feeling. Maybe it's a behavioral health type of question. But we had a lot of our clients during the past year, and especially on the staff side as well, user configurable assessments. These are delivered via text or email. And what's great about it is, especially on the staff side, if you want to do a return to work type of assessment where you want to just continuously monitor your staff members, if they're experiencing any symptoms or if they've been exposed to anyone, they don't need to log into anywhere special. So it's all done directly through Cincy. So that's what a lot of our clients liked, is that everything was all in one place. Outside of COVID-19, these assessments can be configured where they can be condition specific. So maybe, like a CHF type of assessment. Did you weigh yourself today? Yes or no? And the ability to just recognize real quick if a patient's condition is just beginning to worsen, right? So, you want to stay up on how your patients are responding and feeling. And this is a way where you might not have gotten these answers in person. And we make it very easy for patients, for family members to fill out these type of assessments as well too. So they don't need to download any specific app. It's solely sent out via text or email, and then the reporting as well. And we'll talk about that in a minute. So one key part of our assessments is the ability to flag responses. So like I mentioned, we have full reporting into our assessments, but maybe you want your staff, just like the remote patient monitoring, that if someone spikes a fever or their oxygen levels start dropping, maybe you want your staff to be alerted if a patient responds a specific way. So if you see in this instance, and we saw this a lot over the past year as well, that you want to be alerted if one of your patients, maybe you're going to visit tomorrow or the following day, if they have a fever, if they have a cough, if they've been exposed to anyone that's tested positive. So that's where we saw it used a lot on the COVID side as well, that individual nurses and staff have those immediate alerts that if their patient does respond a certain way. Really, just lastly, on the administrator side, administrators, like I mentioned, assessments, they're very configurable. They're very easy to set up within our platform. Like I mentioned, they could be yes, no questions, multiple choices. You can set assessments to go out recurring as well. So another great ease of use on our platform is you don't need to manually assign an assessment each day to different patients. You can set these to go out recurring or automated, however you want to have them set up. So just to talk a little bit about the patient perspective and the clinician perspective, and then go through some of our patient and family feedback during the pandemic. Really, the big perspective that we saw in the beginning and throughout the whole experience, and unfortunately, I sound like I'm talking in past tense, but we're all still working through it, is patients are now quarantined. They might not have specific clinicians coming into their home as often. They definitely don't have family members coming in their home as often. They were very apprehensive about in-person visits, right? So they weren't sure their nurse, where they were, what patient they were seeing. We've also seen on the other side as well, a lot of times the relationship is very strong between the patients and their specific clinician. So they were worried about infecting their caregiver as well too. And not just at home, but we also saw this a lot on the SNF and the ALF side. So we had a lot of clients reach out to us very quickly in March and April of 2020, needing to get a platform going within the next couple of days, where if they needed to drop off an iPad or a tablet within the skilled nursing facility or the assisted living facility, and then their staff can communicate out while they're sitting bedside with the patient, that was a very big use case during that time. Patients also, over the time, since we're solely focused on post-acute and home health, our technology is very easy to use. And the great thing about it, like I mentioned, we're device agnostic. So they're already very comfortable on FaceTiming with the grandkids or maybe using Facebook Messenger. So they're using the device they're comfortable with. And we saw a major uptick, the amount of virtual visits between patients, between family members, bringing in those other staff members as well too. And family members, probably over the past year, have never been more involved in the plan of care for the patient, right? So we've seen a very big increase on the amount of caregivers, and really look for a platform where it's very easy to bring in those family members into the virtual visit or into the messaging. That's a big thing a lot of telehealth vendors are missing out there, is that family member aspect. The clinician perspective or aspect of it, wasn't too much different from the patient side, but a little bit more of and this is pretty common sense and everything that we've heard over the past year. Very similar type of experience of not wanting to be infected with specific patients or having the right equipment with them, but they want to provide very care in a very safe manner, limit the amount of exposure to their patients and to themselves as well. So, I previously, in a previous past life, I was with an EHR company, and for all you folks that went through EHR implementation or training, not too most of the liked people or vendor at an organization. So what I really like about Cinzy, about virtual care, is we make our lives of our organizations and staff members a lot easier. So whether that's communicating quickly, being able to stay in regular contact with their colleagues, with patients, that's what the platform was really beneficial for over the past year. So some things that we covered and some things that we'll cover more, is really how was it utilized by agencies. And, the big one, besides the virtual visits, were pushing educational messages, whether it's by text or email, and providing more care. Okay, so, post-pandemic, pre-pandemic as well too, we had a lot of clients use our platform where they just wanted to supplement in-person visits. And that's what a virtual care platform is great for, because you're going to see your competition is using different virtual care platforms like this, and they're able to provide a lot more care than just the standard in-person type of visits during the stay of the patient with you. So we just like to include some patient and family feedback and some clinician feedback, that we've seen over the past year. I think the big focus, that we have seen over the past year, like I mentioned, is that family member, and also on the physical therapy side. So for a patient that might not have been able to go to a facility or have a physical therapist come over and show them a specific exercise, now the platform, they can do it over video. The clinician, the physical therapist, can be working with the patient and says, let me see you do some of your exercises. Let me see how you're doing them. Or maybe you just need to push them out an automated link of a YouTube video or a Vimeo video of this is how you do that exercise. You can watch it later. But the big thing from the patient and family feedback was, I could still keep my same visits, but now I'm just doing them virtually, right? So, and the big thing that we saw also was the loneliness as well too on the patient side. So being able to either see their family members with their clinician over a telehealth visit was probably the biggest feedback that we got. From a clinician standpoint, really just being able to touch their patients more, see more patients throughout the day, throughout the week, being able to remove those types of, especially in the beginning of the pandemic, remove those types of depression or mental health issues that a lot of patients experienced. That was probably the biggest feedback. And just the easy use of the platform. So, really just how they use their phone or their tablet or their computer on a daily basis. Now I can securely and safely communicate with all my patients as well. Just some feedback from some of our clients from VNA out in the Midwest, and Excellin, who's they're based, actually, they did a webinar for us recently about a month ago. They're based in Texas and California as well too. The executive feedback is huge, right? So where the industry is going and where, I think is here to stay, and we're going to cover that at the end, is where did virtual care fit in? How do they see it from an overarching type of standpoint instead of just a narrow viewpoint of, maybe I might be a field nurse and I just care about my patients, but how does this whole platform fit into my organization? And really looking for a platform where you can manage your staff and you can manage your patients on one platform. So there's a lot of vendors in the marketplace that do patient communications very well, or they might do, like a Slack or a Microsoft Teams that do inter-office type of communication very well. But having everything under one roof, under one umbrella, and especially that's healthcare focus, has been the biggest feedback from executives. So just a little impact on virtual care in general. So Accent Care, multi-state home health organization. They're one of our clients, and really just pulling out some quotes and some different use cases and the way they're using the platform. So we meet with a lot of folks that might be concerned on, I'm not able to bill for these visits for a specific nurse in home health yet. Hopefully, fingers crossed, we'll be having that shortly. But what we found from a lot of our clients, and especially from Accent Care, is whether the visits are billable or not billable, I'm providing better care for my patients. I'm providing an easier way for my staff members and a safer way for my staff members to communicate. Employee satisfaction was very high for this organization during the pandemic. They provided them a platform where they can securely communicate with their patients, and they knew they were doing the right thing by providing this to their patient population as well. So if you look at the last sentence there, as I mentioned, pretty common use of virtual visits is medication management, right? So training and observation of those patients as well too. So just a quick quote from the CEO of Accent Care. Not having a virtual care platform, especially during the pandemic and where the industry and the marketplace is going, was not something that Accent Care was willing to progress to. So they were, very open to giving a platform for their frontline caregivers to just safely answer those calls, and just minimize the amount of risk to patients and other staff members and their family members as well. So some of the use case Accent Care started out with, really their first use case they started out with in the platform was for wound care. So in the state of Mississippi, I believe they only had 2 or 3 wound care type specialists, wound care nurses for the whole state of Mississippi. And those employees were driving throughout the state, sometimes 3-4 hours at a time to visit a patient. So not really a great use of their time, the amount of drive time that they had. Weren't able to see as many patients, obviously, throughout the day or throughout the week. With our platform, a nurse can be at a patient's home. Maybe they need to bring in that wound care type of nurse who now is physically 3 hours away, but they need to just integrate them into a virtual visit with the patient. Now those wound care nurses, instead of driving all over the state, can now see double, triple, quadruple the amount of patients that they would. They saw a lot of great success in the state of Mississippi. And like I mentioned, that was really the first way they used the platform. Now they've spread it to the majority of their locations across the country using the platform for after hours type of triage. So, from a patient perspective, from a family member perspective, they can just hit a button, be directly connected into a virtual teletriage nurse. They can triage the situation and then hand off the virtual visit to the correct person. So those were really the 2 big ways they started using the platform and really branched out, was wound, but huge reduction in hospital readmissions from that as well too. So just a little of the white paper and really the high level results. Patient outcomes for the patients improved, inpatient admissions were reduced greatly. And patients, if they were surveyed after or discussed after, it was a very positive experience that they, before the pandemic, most of them did not use a virtual care platform. And after the pandemic or during the pandemic, a lot of patients did convey a positive experience. So we just included some percentages and just some feedback that we got of our hybrid model, which is virtual care plus in person, versus a traditional model, which is just seeing a patient in person. So as you see, oral medication management had the greatest increase. And I think really the big thing on statistics here is that hospital readmission and readmission on the 30 and 60-day level was greatly reduced. And so not just for Accent Care, we're seeing this sometimes even greater numbers across our client base. You're most likely, if you're using a virtual care platform and you're using it effectively and communicating with your patients, you're most likely going to cut your hospital readmission rate by 50%. So being able to stay up on those patients quickly, give them an avenue to communicate, and just some of the satisfaction levels. So some of the big staff feedback from Accent Care as well too. We could share with you all some of these quotes as well too. But again, just the ease of use for patients, for staff members, using the application that's on their device. Maybe it's a company issued device or maybe it's their personal iPhone, but being able to provide family members. So if you see in the middle quote there, a way to speak with the patient virtually. There was a lot of that great feedback as well too. So this was just a communication from a specific family member, regarding one of their patients back to Accent Care about, the ability to use a platform like this and, being able to see the family member and be very involved in the care. So one of our other clients, Concierge Home Care, based in Florida as well too. They use our platform for a variety of reasons. One is for physical therapy as well too. But very similar to a lot of our other client feedbacks, where just enhanced follow up in real time has been the biggest improvement. So if you're new to virtual care and you're looking for an area to get started in, some of the lessons learned, and we have a professional services team and implementations team and project managers that are assigned to our new clients that come on board. They're typically, very great about sharing some of the lessons learned from other clients they've worked with, how you can have a successful implementation. So I would say though the one big key takeaway, if you're looking to adopt a virtual care telehealth platform, before you even get started, I would identify that clinical champion, within your organization. So if you see on the first one, developing an implementation plan, yes, that is critical. But, the big one is identify that person, people, that might drive this across your organization. So yes, getting buy-in from your entire staff and key folks is important, but really finding that clinical champion that's going to work with your staff members, work with your team. So our team is here to help you, and most other telehealth vendors will provide you that same type of support. But you need that person within your organization that's really going to be that champion, and that's where we've seen the greatest success, is where that person's identified and can see the big picture, see the benefits of using a technology like this. Yes, there might be some roadblocks. You might hear from some folks of, my patients, they're not that tech savvy. They won't use that. It's not the case anymore. We might have been hearing that 3 or 4 years ago, or even 5 years ago. The amount of technology that baby boomers all the way up are using the technology. And if you have a platform that's very easy to use and can convey that to your staff as well too, to convey to their patients, you'll be pretty successful there. So some success measures that you can compare against, our staff utilization rates, and we do provide some patient engagement and patient adherence reporting as well too. But a big thing with using a virtual care platform is you can now go to referral sources. You can go to different organizations that you're working with, and we have different branded marketing material that we can provide you as well too, on different one-pagers and handouts of, this is the type of platform I'm using, and this is how I'm going to be taking care of your patients, and this is what I'm going to be providing their family members. And here's the amount that we can reduce of them potentially be readmitted back to the ER or admitting for the first time. So we help our clients on a lot of that part of the aspect, on the referral source aspect as well too. So what's really next for virtual care now that we're in June of 2021? Have we been seeing things die down a little bit, or organizations using platforms more? I would say we're seeing an increase now. So realizing that this is not going away. This is not here to replace in-person visits by any means. This is really going to supplement and make you stand apart from other competition within your area, nationally, whatever it might be. But this platform this is what patients and family members are looking for. And, if they don't have a way to communicate with your staff, or, have that virtual type of communication, they might be looking somewhere else. So if you've seen the first point right there, we've seen our clients use their telehealth platforms, and Cindy as well too, as a white glove type of service, or a VIP level care. So like I mentioned, a lot of family members, whether they're in their 20s or 30s or 40s or 50s or 60s, looking for an app they can go and download, or just log into a web page. They can see their parents' clinicians in there. Maybe they need to send them a secure message. And again, that's all configurable within our platform and most other platforms. But that's a nice way to provide that VIP level type of care to family members. And not just virtual visits itself. We're seeing a lot of our clients, and a lot of clients that become our clients, coming over to us from other vendors of, I need more than just video. I need to do remote patient monitoring. I might have my CHF patients that need to take their oxygen, but I want to gather that data as well, and I want to communicate with them virtually. So, really looking to expand beyond just video. Find a platform with secure encrypted messaging to patients, to family members. Find a platform that can conduct assessments, so a survey as well, and push out electronic education. So it's our clients, not every patient communicates the same way, right? So, we found a lot of our clients maybe they'll do something specifically for certain patients, and then maybe they'll do something else for another group of patients. But having all those modalities of communication under one umbrella and allowing your staff members to choose what they want to use, is the type of platform that you should be looking for. And really, the type of platform also you should be looking for is not just family members, being able to include all those other folks that are outside of your organization. So, we have a direct integration with live video interpreters as well. But, let's just say you're looking to add other people outside in the community, whether those are social workers or nutritionists like dietitians or maybe behavioral health specialists, being able to add all those folks within the platform and being able to easily bring them in virtually. So I just want to thank everyone for their time today, and really just to recap, virtual care, if you're new to it, and it's not meant to replace in-person visits. If you're using virtual care currently, you know that it's not meant to replace in-person visits. It's really to supplement, improve the quality of care for your patients, for their family members, and really to set yourself apart. Because like I mentioned earlier, every other industry and every other vertical and everything that we use in our daily lives is on demand, is virtual, has a platform like this. So healthcare is next up, and it's long overdue. And we're seeing some great growth in this space. And the next 5 or 10 years is not going to slow down. So I just want to thank everyone for their time today, and appreciate it. And if you have any questions, please feel free to reach out to me directly by email, or you can go onto our website, cincy.com, read some of those testimonials, some of those use cases. And if you want to see a full customized demo to your organization of what you're looking to accomplish, there's a form in there that you can fill out, and we can reach out directly and set up some time.
Great. Well, yeah, thank you for a great presentation, Michael. So I'm looking at the chat here. It doesn't seem like we have any questions currently. Okay, there was one question in the Q&A section. She actually found the answer herself, but just so that others know, she wanted to know if the presentation would be available afterwards, like the slides.
Perfect. Thank you, Ryan. Appreciate it. And thank you for everyone's time today.
All right. Thanks, everybody. And there are no further questions, I guess. Thank you, Michael, again. And up next is our lunch break with the exhibitors, and the breakout sessions will resume at 1 p.m. Eastern. Thank you, everybody, and enjoy your lunch.
Thank you.
Thanks, guys.